you guys to get a chance to know Andrew. Andrew has been practicing physical therapy. How long have you had hands on people?
Doing hands on people for 42 years.
42 years.
Working in physical therapy for 40 years. A licensed PT for 36.
So you know what that means? Andrew's a master. I've been doing massage therapy for 25 years. I'm not yet a master. This man is a master, and the thing that you are most passionate about, is the myofascial and the craniosacral work. And a lot of people, when they come into Wellspring, or when we're talking to them about myofascial and craniosacral, they're not familiar, and they want to know what it is. And we try to give them the scientific definition, which I'd love for you just to give us a quick breakdown. It's really hard to describe, right? It's like trying to describe infinity. But if anybody can do it, you can.
In a sense, yes. So myofascial work is connective tissue runs through the whole body, every bit, around every muscle, around every organ, in between every different thing in the body has a divider. It's kind of like tissue paper, but it turns out it's more dynamic than that. If you take two strings knotted together and you pull a different direction, it just changes the direction of the pull. But in myofascia, the connections actually change. And it's very dynamic. It responds to pressures and tensions. All of the fascia is bathed in fluid. I like to think of the fluid as maybe like an olive oil. So everything's slippery and slides and glides and moves when it's working normally. But the fascia gets stuck. The oil gets thick. I think of it as like Jell-O setting. And if something is supposed to be gliding and moving and sliding, and now it's stuck in set Jell-O and it can't move, that's a problem. In addition, a lot of people believe now that myofascia conducts energy. It's actually not fibers, it's tubes that have a water-like substance in them. So that's another aspect that maybe it conducts energy, maybe things actually flow through the fascia as well. So when I work on people, I gently put tension into the fascia, and then the hardest thing is being patient, letting it release, letting it just go. And you have to wait for it to happen. You're not forcing something, you're putting the pressure in and then just waiting for it to let go on its own time frame. When that happens, heat usually comes out. It gets very warm where you've done a good release. So that's myofascial stuff, and that could be anywhere. It could be little teeny areas, finger to finger. It could be an entire region, palm to palm. It just depends on what the body asks for. Craniosacral stuff is a little different. It's more, I think, in the energy realm, and there's a rhythm that the body has that can't really be sensed by scientific instruments and things, so it's more in the energy realm, like acupuncture. But there's a rhythm, and you listen for that rhythm, feel for, and when that rhythm is out of whack, you try to reestablish it. Get things flowing how they should be in that rhythm. That's more subtle. Reiki work is even more subtle. You don't even touch people. That's pure energy. Some of the physical therapy techniques are just physical force, pushing joint mobilization and hard soft tissue mobilization. What makes what I do different is I'll run through the whole gamut from hard physical to pure energy, but I'm not making decisions, the body is. I'm listening, I'm plugging into the body, seeing what it's asking for, what it needs, and doing what it wants me to do. That's very different than everybody else. Somebody could be a master at a technique, but then they're applying a technique to a body. They're saying, I see this is wrong, and I'm going to do this to fix it. The difference with what I do is I'm not applying a technique. I am, in a sense, but I'm not making decisions about what I do. I'm plugging into the body, listening and doing what the body wants me to do, where it wants me to do it, might not be where the pain is. People might have a sore shoulder and I end up working on the opposite hip because that's the origin of the problem. It's not just where the pain is.
You know, what I hear you saying too is that you have tools, you have knowledge,
I do
you
apply
have
techniques.
experience, you apply techniques,
Yes.
and your greatest sense of awareness is that you're showing up to the table with a profound sense of respect for where the work will take you.
Yeah.
You're not, and I am, so I've received your work now probably at least four
At
times.
least 3 or 4.
Okay. Every time I receive work from Andrew, I am instructed on the art and the mystery of connection. And he's kind of like my Yoda sometimes. And, you know,
Without the funny language.
yeah. Well,
It's body language.
go slower now, or something like that, right? Like, you're always like, slow down, feel it, be in it. And I have been my body's been profoundly intersected with healing, with this way that you approach the body as a mystery. You can come with, you know a lot. You've worked with people on all levels all day long for many years, but now you're really focused on pulling away from the regular PT model, right? And what you're doing is just your passion, almost what you were created
What I
for.
love to do. To me, when I have my hands on a body, it's like playing an instrument. I love to be in that zone. And the biggest difference is, instead of me worrying about, oh, I need to do this or tighten this or loosen this or get something to happen, I'm just listening, just seeing what the body wants and going. So every time I work on somebody, it's a voyage of discovery. It's an exploration. I don't know where I'm going to end up or what technique I might apply or anything. I just listen and in the moment go where it's asking. And so every treatment is unique. People say, well, what do you do? And it's like, I don't know, because I could do officially.
Takes a lot of confidence to say that, right?
I am applying techniques, but I don't know which one I'm going to apply. I don't know where I'm going to apply it, and I don't know what the end result is. Sometimes it ends up being a more emotional thing that I'm working on as opposed to a physical thing. And again, I'm not making those decisions. The body is leading me to an emotional thing or a physical thing or a muscular thing. Doesn't mean I can't do physical therapy. You know, I can do whatever needs to be done, but I do it being directed by the body I'm working on.
And that's one thing I've loved. I've observed you with several clients, they're coming off the table, and you've spent all this time finding what you didn't know you were seeking for, finding answers, finding unique, just following their tissue and not listening so much to like diagnostic codes or words that try to describe it. You're just, what do I feel? But then the other thing you can offer clients is you can say, you know, this is what we found, and here are some movements that you can do that are going to help you. And here's an awareness. I'd like to bring you an awareness to this place, because sometimes them just even knowing it exists,
very much,
and not being disassociated from it actually helps that healing process.
Yeah,
Pretty powerful stuff.
So,
well, what else do you do besides this this magical, mysterious, mojo, miraculous stuff you do?
You mean treatment-wise or
personality-wise? Personality-wise, yeah.
I like to do a little bit of everything. I'm a fixer. I love tinkering with things, fixing things. So fixing human bodies is right up my alley. I love working with my hands, so I throw pottery when I have the time. Hiking and mountain biking and getting out. Anytime I can be in nature, I'm good. That's, you know, I love gardening. If I can get my hands down in the dirt, that grounds me and makes me happy. So, or it's reading or movies or you name it.
And you've just recently kind of put your tent pegs down here in the North Fork Valley. So
just moved here, and that's what's been keeping me busy. But now I have a house in Paonia, and I'm a resident of the valley, and I still go back to Denver because I have people to treat over there, but I want to cut that time and increase this time as much as I possibly can.
And just hearing you say that really brings to light something that we all know is really special about this valley is you can't see H Hill behind me, but I think you all know, you've heard me say it a few times, is that some people, I don't know, it's crazy, they think that H on H Hill stands for Hotchkiss. So weird. It actually stands for healing, as far as I'm concerned anyway. And we're so blessed with so many healers, not just at Wellspring, but all over this valley. People are doing really groundbreaking stuff. I don't know that we can find too many other pockets in the world where there's this small of a population. And yet we have so many people who are practicing the healing arts. It's a blessing.
Yeah.
And so I want this community to really engage with Andrew's gift, because you don't have to stay in pain. You don't have to stay in, a lot of times it's emotional too. You're helping people unwind emotions.
Emotions, and there's unwindings that happen. And the most important thing is, even if somebody is maybe a master at a certain technique, they're really good at osteopath or chiropractic or massage, to me, they still have a little bit of blinders on because they're working within their realm. Now, their experience expands that, but they still are focused on what they do. My experience has broadened me enough, again, from energy to physical, so I don't have a restriction on what I do. I don't think, and I think that's what makes it unique. It doesn't matter if somebody has had a pain for 10 years because of an injury or pulled their back yesterday. Applying what I do makes a difference in both of those situations.
Yes.
I mean, stuff, I can't tell you how often I'll work with people, but because I'm approaching it differently, they'll say, oh, I've been to the therapist, I've been to massage, I've been to the chiropractor, but it's just not quite gone yet. And then I'll work on people, and not every single time, but often enough, I'll find the thing that they've all missed because they're focused, they have blinders, and there's something that lies outside of that. Or maybe it's a combination. Maybe there's really good massage things and chiropractic things, and I'm finding one other thing that needs to be done. And so it can make a difference, even chronic pain, long-standing problems. Sometimes they'll change in one session because you find the right origin of the problem.
I'm going to be a little vulnerable here, which you guys know I don't usually mind doing. But a lot of times people are concerned about a male therapist. And I think that's really an injustice to many of the great male body workers that we have around, but I understand why. And in my work where I've been experiencing and receiving work from Andrew, it has been profound. I can't remember if it was knee or ankle pain, one of the two, where you were following them and then you came back up and you followed into an area that could have been, it was close to places that don't need to be touched for body work, but you got as close as you could and you were so respectful. And because of your willingness to hold that space, I had a huge emotional, spiritual, mental release as my body released. It allowed some of the abuses that have occurred for me to actually melt away and not have any holding space in my body anymore. And I know I've heard other people that you've worked with have had similar experiences, but I just want to say that every woman that I've talked with who's had those kind of experiences has felt safe. And that's just such another gift that you bring to your work. I'm really grateful for it.
That's a hard thing to talk about. I don't know how words can address it. All I can say is having the utmost respect for the body, it pulls away sexual stuff, and it's just, this is a body that needs to be treated. And when I'm treating. It has nothing to do with all of the other things that we overlay.
Right.
over what a body is. And the treatment is, again, following what the body's asking for. So it's not like I'm invading a space that doesn't need to be invaded, or going somewhere that's not appropriate, or this or that. I'm very slowly, very gently going where it's asking me to go. So going there is with permission. And I always when it gets dicey, I ask permission. I talk about, I say, this is what's happening. This is where, because the most important thing for me to work with people is they have to be comfortable in every way. They have to be comfortable with temperature, with how they're physically on the table, with everything that I'm doing. And I never want to make one iota of go somewhere where the person is not comfortable.
It's kind of, you're creating that intention for healing because you're making sure that the connection is safe. So that's
Well, I
beautiful.
think that's the word, is safety. Is like in my mind, especially, sometimes I'll feel like, oh, there's a very highly charged emotional thing, and the main thing that comes through me is safety. Is whatever was there, if we can get it up and out and gone in a safe environment where there's no other threat, no other, that's a good thing.
Yes.
So safety is one of the huge words that my hands impart. Is like, no, things are safe. This is okay. And that's all I ever want, is for people to feel good and safe and comfortable.
I love that about you, and I love that about your work. We're so excited that you're here with us at Wellspring, that we're getting to create so much healing together. I love referring people to you because I know that they're going to have major differences and major healing. So glad you're here.
I love doing it.
And give us a call at Wellspring. Let's get booked in with Andrew. You will not regret it. You may have been holding on to pain, like he said, for 10 or more years. It may be an injury that just happened yesterday, but this is a wonderful modality, a wonderful man, wonderful healing hands, and we are so glad we get to help share them with you. Share him with you.
Thank you. Thank this valley for letting me be here.
So glad you're here.
Where
All
I wanna
right.
be.
Love people, love vitality. We'll talk to you soon.